Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Yes, I'm living it up. Nita, how did you know?
I don't know. I must be psychic, but I'm living it up, too. I guess I learned that from you. We're on the air 12 years together. I had to learn something, right?
Yeah, that's all you need to know is right there. That's the end of it all.
Okay, perfect. So we want our listeners to also live it up. So this is a program about musculoskeletal pain, basically orthopedic pain, and you're going to be able to call all hour long and speak directly to Dr. Darrow if you have muscle pain, joint pain, tendon pain, disc pain, back pain, ligament pain, neck pain, knee pain, hip pain, arthritis pain. Maybe you have stiff joints, dull aches, basically orthopedic pain. So give us a call right here, right now in the studio at 866-870-5752. That's 866-870-5752. And when you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. I counted them myself. And the foreword is written by the lovely Suzanne Summers, and it's a book that it's a must-read, really. And so we want you also to check out the doctor's website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. We're here Saturdays at 10 a.m., again at 1 p.m., and we are waiting for your calls right now, right here in the studio, 866-870-5752. What do you think?
I'm ready to rock and roll.
I'm ready to rock and roll right with you.
Did you hear about the rumor about the butter?
The butter slid onto the ice.
That's not a joke, though. Well, I'm not going to spread it.
Okay. Got it.
You want a better
yes.
one? Why did the photo go to jail?
To get printed?
Nope. Nope. Because it was framed.
Oh.
You were close, though. I have to admit, you were close, but no cigar.
Yeah. I know. I'm getting better. I've gone from minus 50 to like minus 40.
You are so funny.
Okay, well, we're getting some calls. Well, I love you back. So, and we love our listeners. So let's go right to Richard in Los Angeles.
Ricardo, Marc Darrow, Dr. Darrow to you. How are you today, sir?
Good morning, doctor. Well, let's see. I'm 77. I have been having back pain probably for, 20 or 30 years, on and off. But for the last few years, I have major problems going to pain management, getting shots in my back. It worked for 2 or 3 days, and then it started hurting again, so it was worthless. Then I went to acupuncture. That didn't work. Now I'm going to an osteopath, and he's cracking my bones and stuff like that. I don't know if it's working or not. I did have.
Well, you're the guy who would know. You're the guy who would know. So did I hear you say you had surgery on your back or no?
I had it on actually my neck. Went through the front and hit the back and it did help my feet and my hands. I was having lots of problems with that.
That's good.
The surgeon said that I should, if I wasn't my age and I wasn't in the shape I'm in, he probably would do back surgery. But he says it's not worth it. He says it's a 50-50 chance, number one. And number two, it could maybe be worse. So
your surgeon is a very, very smart man. And I'd actually, I'm going to talk to you later to find out more about that, because most surgeons do operate on neck or back pain. And that's
that's why I felt it was true, because when a surgeon says you shouldn't do it, you got to listen.
I love that guy. But unfortunately, there aren't many guys around like that. Usually, surgeons, at least from the patients that I come in, or who come into my office, who see me, who have had a failed back surgery, it was because of neck or back pain. And that doesn't work. If you've got that tingling or numbness down the arms or legs, then it's a better reason to have a surgery, or weakness in an extremity.
Well, starting
so I love your surgeon.
I was a road rep, and I carried heavy bags and things for about 10 or 15 years. And I guess it's finally working out on me. And I don't remember all the things they said about my back, but it was, this is crushed, and this is pushed, and this is this, and this is that.
No, it's not relevant. It's not That's usually not relevant. And it's the most difficult thing that I have to tell new patients who walk in the door. It takes me sometimes up to an hour or so to get them to understand that they are not what their MRI or X-rays show in terms of their experience of the world. Everybody, in medicine they say if you look, you find. We all have things that are inconsistent with what we consider to be healthy. But that doesn't mean they're ever going to cause us a problem.
Right.
There's a lot of studies shown that on autopsy, that's after someone passes on.
Well, I heard about stem cells, but I was concerned because of the cost.
Okay. Well, let me finish up what I'm saying, because it's important. When studies are done on people after they pass on, and that's often by autopsy, you guys know what that means. When we look inside, we find all kinds of things that should cause pain. And then we check the records. The person never had one complaint of having pain. And then doctors also and scientists do studies on people who have no pain. We quiz them. They have zero pain. But when we look at the MRIs we do, or X-rays, we find all kinds of problems. So I just had someone come in the office yesterday like that. Terrible looking MRI, but the person had no issue really, nothing for that area. And even when I explained that to them, they could not understand it, because people think they are what they look like inside, and they're not. Sometimes they are, but most of the time they're not. And we can heal using stem cells and platelets, which we now term regenerative medicine. That's the buzzword. And it's called regenerative medicine because we actually regrow tissue. It's been shown on biopsy and by X-rays and MRIs that cartilage can grow back. When I told my professors in medical school that, they told me they're going to kick me out of school if I didn't shut up, because that's impossible. And now we have all of the science behind it. And you're going to get a copy of my book, Stem Cell and Platelet Therapy. And the byline is what's most important. Regenerate, don't operate. Don't take good things out of the body, because it destabilizes it. And then you have big problems later. Yes, there are times when surgery makes you feel better, but typically in the long run, that's going to fail. It's like steroid shots, cortisone. I don't know what you had when you went to the pain doctor, but they usually give cortisone shots. It's a strong anti-inflammatory, but it's also a strong tissue dissolver. So if you get that in your joints or your tendons or ligaments, neck, back, I don't care where it is, it can feel good for a while, but like you said, it didn't last. You said it lasted 2 to 3 days. And that's what we find commonly. So I don't typically ever use steroids like that. If someone comes in and they're hunched over with a terrible back sprain or neck sprain, I might use it then. And the reason is because the person just can't function. They're bent over or sideways or something. And they'll get right up in 2 seconds and go, my God, I'm healed. And I go, don't pretend you're healed, because we have to go back, and now we have to regenerate those ligaments or whatever it is that are causing the problem. Most issues that I see really are from sprains of the musculoskeletal system. That means the tissue is being stretched out, or it could be arthritis where the tissue is being worn down from overuse. Like you had, how many years of carrying the heavy bags when you're a road rep? Started in 1970. That's a long time. So I'm going to bet you anything you want. I'll put up any amount of money you want that you have a sprain in your back. Okay? And that's not diagnosable by x-rays or MRI because that doesn't show those things. It's diagnosable when I touch the area. My fingers are my x-rays and my MRIs. Does that make sense to you? I've got to touch the area and find out where the pain is being generated from, not from a film. I do have people get films. There's no question about it. People come and they go, I listened to your radio show and I didn't get an MRI because I know you don't like them. Well, that's not true. I like them, but I'm not going to diagnose from them. They can tell me all kinds of things that I didn't expect. And a couple of times in my career, I've actually found cancer, more than a couple of times, by doing an MRI or an X-ray. So I do like to do them because cancer can cause musculoskeletal pain. I don't want to miss anything, so I always get those images, but I don't treat based on them. Now, you want to know about stem cells. Anything to do with the cost and all that, you have to call the office, and the phone number to the office is 800-300-9300.
Oh,
That's 800-300-9300. And the other, do you have a pencil yet?
I'm almost. I'm ready.
Almost.
800?
Okay, it's 800-300-9300. And the other thing you can go to
800-300-90
is the website. 9300.
Okay.
800-300-9300.
Got it.
Yeah. You can go to the website also to get more information about that, and that's www.lastemcells.com. I'll repeat it for everybody else. It's www.lastemcells.com. And the cool thing about my website is you can email me through every single page on the website, and I respond to every single person's email immediately.
Okay.
I'm an email junkie. People say, why are you always on your computer? Because people email me from every country in the world all night long and all day long. We have people fly in from everywhere to be treated. I had 2 people on this last week. Sorry?
Thank you so much.
Yeah. Anyway, it sounds to me like I can help you, like maybe platelets and stem cells. We use bone marrow to obtain the platelets and stem cells at the same time. People go, I don't want to do that. You have to put a needle on my pelvis. It's shorter. It's a shorter procedure than drawing blood, believe it or not. Once I numb up the area with a shot of lidocaine, it generally is going to take me about 15 seconds to get the bone marrow out.
You can even use some of it for somebody else if they don't want to.
Well, unfortunately, we can't do that, but that would be a great thing, and someday they'll figure out how to do that. But so far, the FDA is very watchful of us and doesn't allow us to save the bone marrow and the stem cells and the platelets. So, Richard, God bless you, man. It's been a pleasure, and great questions. We were able to get out a lot of information to people because of that. You know, the other thing that I always tell people is I'm the best example of regenerative medicine because I started doing it in the 90s on my own body. And I was a wreck when I was in my 40s. I'm 73 now, and I can do any sport I want to. But in my 40s, I was pretty much laid up because I'm a heavy-duty athlete, repetitive. I love repetitive things. I play 5-string banjo. I play guitar, mandolin. I like to just sit there and
the way it is now, it's not worth living, and so happy to hear that there's a chance for me.
Well, you know, it is worth living, and you've just got to figure out a way to get what you want. And this is what I tell people every day. One of the biggest issues we have is people are overweight, and then they come in with arthritis in their knees or hips or their feet, and they go, why do I have arthritis? No one in my family does. And I go, because you've got an extra 500 pounds on your knees. And they go, I don't have 500 pounds. And I go, biomechanically you do. Every extra pound in excess on your tummy is 5 extra pounds on your knee biomechanically. And most people that come to see me are overweight. So that's something that I work with them. I put them on a ketogenic diet. And the average person males lose about half a pound a day. Females lose about 3 pounds a week. So that's something, Richard, I may as well ask, are you overweight?
Richard, are you there?
I sure am. Thank you.
No.
I don't.
He didn't want to answer.
I actually, what happened was it clicked off for a second, the phone. I'm not sure. Maybe somebody sent me a message or something. But I didn't hear the
problem.
question.
I just asked you, are you at all overweight?
I think the word is obese.
Okay, that's a good word. And so,
well,
I don't know if you heard anything
I went to
I
the
said,
doctor, and he said to me that my height fluctuates, and I'm in a short period right now.
That's cute. That's so cute. Anyway, Richard, why
How
don't
about
you
another
call
one
the office?
while we're on the phone? I got on the scale, and the ticket came out. It said, one at a time, please.
We need you here,
That's so
Richard. This is
funny.
fabulous.
You're going to write those
you
two down,
should
okay?
run the show.
Just remember my name.
But excess weight can cause back pain. Right
Yeah,
there.
there's no question about it. I've been on a diet, honestly, since I'm, 9 years old. And I lost, I was at 365, and now I'm at 220. But I should be at like 190, 180.
Well, you can do it. I'll show you how to do it.
Yep.
Nothing to it. Okay, Richard, God bless you, man.
Okay.
Yeah, we're going to move on here.
So that's a lot of great information. And our number is 866-870-5752 right here in the studio. That's 866-870-5752. And check out the website at www.lastemcells.com. That's lastemcells.com. You can see Dr. Darrow performing the treatments on videos and email him off of every page on the site. Your favorite thing, emails, you said a while ago. And if you're listening for a while and you want to just call the office, that number is 800-300-9300, 800-300-9300. And the most important thing is that when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy. So if this is new to you, you want to call in and get this book. The subtitle is Regenerate, Don't Operate. It has 264 scientific studies. What do you think?
It's a great book. It really is. It took me 5 years to put it together. Getting all the research that all the doctors say there is no research on this. I hear it every day, Nita, when patients come in. They go, my doctor doesn't think there's research on this, so I shouldn't do regenerative medicine of stem cells and platelets. And that's a doctor that's not keeping up, guys, okay? The research has been there forever, and I've been doing this work for 20-plus years, and it works real good on me. I've injected my knees, my shoulders. I even had a shoulder surgery that failed me. When I was a dummy in medical school, I allowed my boss to do it, and it came out bad. And it was a few years before I discovered regenerative medicine, injected my own shoulder one night, and woke up the next morning completely pain-free. Okay, so there's good hope on this stuff. It's not going to work on everybody, and the biggest reason it doesn't work is because people quit. They'll get one treatment and go, it didn't work, and my surgeon said it can't work, so they give up. Other reasons it can't work is excess activity. That means you get injected with platelets or stem cells, and then you go out and you do your sport again or whatever it is that you do that's activity-wise, and it doesn't allow you to feel the goodness of what's going on. Another thing is sometimes people take anti-inflammatory medicines like ibuprofen, and that actually blocks tissue growth. Don't take that stuff. There are people that take it all day long. Literally all day long they take ibuprofen or other anti-inflammatories, and then they're wondering why they don't heal. The body naturally heals itself, and these injuries that we have are set up to have us heal. When you have an injury, and let's say you sprain an ankle or something like that, what happens? There's an inflammatory stage, and the inflammation actually brings fibroblasts to the area. Those are little cells that spit out new collagen, which creates cartilage. So you tweak a joint or a tendon, don't take anti-inflammatories, please. let it heal itself. Let the body heal itself. The other issues why people don't heal is they go to a doctor who doesn't know what the heck they are doing. If you're going to go to a doctor for regenerative medicine, you better sit down with them and quiz them in great detail. How many of these do you do of this body part every day of your life? Don't go to a chiropractor to get regenerative medicine. I love chiropractors for the goodness of what they do with their hands and helping people heal, but not as a setup to get all their patients to do stem cells or platelets, because they're going to hire a doctor who doesn't know what they're doing, or a nurse. And the last reason is most doctors do not use ultrasound when guiding their needle. They just put it into a big dark place and hope it gets to where it's going to go, or the doctor will give one injection. I hear about this all the time where orthopedics will give a shot of a stem cell or a platelet into a shoulder without ultrasound. He has no idea where that's going. I'm sorry, I love you guys, but it's true. And I was like that in my training. And then when I learned about ultrasound, and I learned that you have to actually watch that needle go into the body, in the shoulder, the hip, knee joints, things like that. You don't need it for a low back or a neck, but there are parts of the body you do need that ultrasound for. And one poke is generally not going to do it in a shoulder, okay? You've got to cover all those rotator cuff tendons. It's a bunch of injections. So you got to go to somebody who knows what they're doing. And if you're far away and you don't want to come here, do a good inquisition of your doctor. Don't be shy. Doctors are just people. They're not gods anymore. They used to be when I was a kid. We prayed. We prayed to the doctors. We listened to everything they said.
Yes.
I hope all you guys are smart enough to know that doctors are just human beings and they make mistakes and they don't know everything. And I'm in that category. I'm not going to tell you I know everything at all. And my patients educate me every day. When I'm examining a patient, I have a computer in front of me, and they'll tell me all kinds of things, and I look them up on the spot, okay? And if your doctor's not doing that, I think he's back in the dinosaur age. Things are changing. Things are getting better all the time in medicine.
Well, that's true, and our number right here, right now is 866-870-5752. Right here in the studio, you can speak directly with Dr. Darrow about your pain issues. And that's orthopedic pain or musculoskeletal pain. That's what we're talking about here on the program today. And you'll get Dr. Darrow's latest book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's a great read. Because if you're looking for science, there it is. Go ahead.
Anita, I got a quick one before the break.
Yes.
This is an email that came in recently. It says, and this is hysterical if you think about it, okay? Think about the words I'm saying. I'm suffering with spinal stenosis and right hip replacement. There's a lot of discomfort. What does that say to you? I'm suffering from a hip replacement.
Surgery went wrong.
That's right. And unfortunately, the people that come to me, and I know that I have a jaundiced eye about it, because the people that come to me have had failures. So I think everybody's had a failure with surgery. Okay? That's just what I see. I know a lot of people do well, or at least for a while they do well, because I have people that come that have had a surgery, did well for years, and then it failed. So, number one, spinal stenosis in and of itself does not necessarily cause any pain, okay? That's number one. That's a diagnosis by way of an MRI or an X-ray. Now, it can be diagnosed just by what the patient tells us, but most of the people that have spinal stenosis in the neck or the back are really just having neck or back pain, which we can help, okay? So be watchful for that one. The right hip replacement, it may not have been done for the right reason. A lot of people have hip arthritis or any joint arthritis, and they have no pain, okay? Let's go to the break, and we'll get back to this. God bless you, everybody.
Okay, give us a call, 866-870-5752. You're listening to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.